The World Health Organization's director says we have the inventory to end the pandemic. It's just not being used properly. He says right now 5.5 billion vaccines have been administered, but 80% of those have gone to high or upper middle income countries. He says now rolling out a third dose instead of giving it to countries who haven't even had one means the virus will mutate. The World Health Organization's director says right now booster shots should only go to the immunocompromised.
The world's G20 leading economies hold the key to vaccine equity and ending the pandemic. We do not want to see widespread use of boosters for healthy people who are fully vaccinated.
Just days before the U.S. is set to roll out their first round of mass booster shots, world leaders say a forecast shows a significant decrease in vaccine donations to low-income countries.
And what they reported was a 25% reduction in the number of doses.
As of August, the White House says the U.S. leads the world with more than 110 million donated doses, but world health leaders say other countries are struggling to reach the goal that ends the pandemic. 10% vaccinated by the end of September and 40% by the end of the year.
The low-income countries, today they're at 1.4, 1.5, 1.7% coverage.
The CDC says there's also vaccine waste that happens when a facility opens a vial and can't use all the doses in time. While they don't report waste, South Carolina's data shows 53,000 were thrown away in the last 6 months. On another point, World Health leaders say booster shots right now won't do much to end a global pandemic.
Throwing another life jacket to people that already have one is not the most effective way to save lives.
Leaders say if other countries can't even get a first dose, more variants will emerge and spread.
There is a false sense of security that if your population reaches a certain percentage, that you will be safe. The Delta variant is showing us that we cannot sit on our laurels. We have to remain vigilant and do what we can to ensure that we stop this virus from circulating as much as we possibly can.
Now, they're also calling on manufacturers to share their technology and knowledge with other countries to get more doses administered. They say it'll take about 2 billion doses to get the world at that 40% goal. For now, the world is producing 1.5 billion doses each month.
Trey, Jennifer, hundreds of first responders were called to that horrifying scene, as we know today as Ground Zero. And Myrtle Beach's Felix Cruz doesn't want a single soul from that day to be forgotten.
Somebody killed a policeman today, and a part of America died. The flag of our nation won't fly at half-mast. To his name, they will add a gold star. Behind our locked doors, a cop put his life on the line.
Felix Cruz reads a poem, a prayer of sorts, as he remembers his fallen friends on 9/11.
I just remember the devastation, what it looked like.
Cruz remembers the clear blue skies that morning.
Beautiful.
But that beautiful morning soon turned dark.
It went from a beautiful sky, beautiful day, to it just changed, it flipped.
Cruz was working election duty. It was the New York primary that day, but instead he headed to Ground Zero.
Your heart's beating, not knowing what to do. But we weren't trained for a terrorist attack. Buildings down, cars crushed, body parts scattered around.
He shares personal photos of the wreckage with the hope the world can see a glimpse of it through his eyes.
It was tough, it was hard.
He thumbs through photos of those first responders who died.
I don't want people to forget my coworkers who made the ultimate sacrifice.
Some still pay the price today.
So many people, volunteers, firefighters, police officers are all still losing their lives because of the deadly toxins we're exposed to down there.
A hero's remorse.
We feel guilty that we didn't do enough.
The country continues to find its footing after those attacks, but its legacy ripples through time.
Ground Zero and 9/11 wasn't just that day.
And through poetry, Cruz never forgets the fallen.
He answers the call and gave us his all.
Cruz says a fellow police academy classmate died just this past June from health complications related to 9/11. He says he gets checked out every year through the World Trade Center Health Program. That's where 9/11 responders and survivors get treated for conditions related to 9/11. Trey and Jennifer. Jennifer, those doctors and teachers participating in today's Q&A session say it's going to take all our help to keep school doors open for the entire school year. From stigma around mask wearing in the classroom.
Don't shame them. Don't make them feel bad. Just say it's okay.
To medical expertise.
The reason that these variants are able to take hold is that our vaccination rate is too low.
This virtual crowd is made up of teachers and medical professionals, all of whom hope to keep COVID-19 at bay in schools, but not without some difficulties.
Teachers are desperately trying to keep kids spread out, but then you have situations like recess. And so then you have all the kids who are spread out for most of the day are no longer spread out.
And to one teacher, mask wearing is hit or miss.
Because it's been left up to the discretion of parents and children, it really just depends on the culture of the school, I think.
A key point, the importance of testing.
Testing is a critical component here, right?
If we stop testing and we stop quarantining, is that the situation that we're already seeing in our children's hospitals would become even worse.
The South Carolina Children's Hospital Collaborative says the number of children with COVID who need critical care is increasing. There are more children on ventilators now than at any other point in the pandemic.
We have to figure out a way to test the kids that need to be tested.
But some of these panelists recognize only so much can be done in schools at the moment.
We've kind of had our hands tied to some degree as far as mandates and things like that. But to some degree, our hands being tied creates opportunity.
And ask leaders with SC4Ed if they're working with lawmakers to have conversations about that proviso which makes it illegal for mask mandates in schools. Now, SC4Ed's co-founder says they've been in conversation with members of both the House and the Senate, and they're encouraging parents to reach out as well.
Yeah, Jennifer Trey, well, overall, the South Carolina chapter of the American Society of Civil Engineers gave infrastructure across the state a poor rating. Also adding on to that, a mountain of a price tag to improve it all. South Carolina's infrastructure does not pass the test.
The cumulative grade for the 2021 report card for South Carolina's infrastructure is a D+. A D+ means our infrastructure is in subpar condition and requires attention.
In the last few years, attention and money has come with the addition of a gas tax, local sales taxes, and most recently, federal American Rescue Plan money.
We got to do something now. We can't wait till later. The longer you wait, the grades continually drop.
Ryan Harvey is the president-elect for the Civil Engineers chapter that published the report cards.
I think this could help lawmakers make a lot of good decisions based on where we need to be and where we are now.
Right now, they found that roughly 50% of primary and secondary roads are in poor condition. More than 10% of the state's bridges are structurally deficient, above the national average. Then there's the price tag to fix it all.
The numbers are out there, and this is what it's going to take. And from that point, it's rather daunting.
The report suggests that even with the $600 million in potential gas tax revenue, the state may be $43 billion short of the funding they need for roads over the next 2 decades. For Harvey, he says that should put roads at the forefront if or when any federal infrastructure funds come into the state.
Do you want to move to a state that's the bridges are in bad shape, the roads are in bad shape, or do you want to move to an area where everything's going in the right direction?
And probably to no surprise, the report also found that Horry County is leading the state in population growth. Now for Harvey, he says a key remedy to all of this sits right now in Washington. He says this state desperately needs that funding from the infrastructure bill that's still yet to be voted on in the House.